Question 281. A male client with cholelithiasis has a gallstone lodged in the common bile duct. When assessing this client, the nurse expects to note: A. Yellow sclera. B. Light amber urine. C. Circumral pallor. D. Black, tarry stools. Question 281. Answer: a yellow sclera. Question 281. Explanation: yellow sclera may be the first sign of jaundice, which occurs when the common bile duct is obstructed. Urine normally is light amber. Circumral pallor and black, tarry stools don't occur in common bile duct obstruction, they are signs of hypoxia and GI bleeding, respectively. Question 282. Nurse Hannah is teaching a group of middle-aged men about peptic ulcers. When discussing risk factors for peptic ulcers, the nurse should mention: A. A sedentary lifestyle and smoking. B. A history of hemorrhoids and smoking. C. Alcohol abuse and a history of acute renal failure. D. Alcohol abuse and smoking. Question 282. Answer: D. Alcohol abuse and smoking. Question 282. Explanation: risk factors for peptic, gastric and duodenal ulcers include alcohol abuse, smoking, and stress. A sedentary lifestyle and a history of hemorrhoids aren't risk factors for peptic ulcers. Chronic renal failure, not acute renal failure, is associated with duodenal ulcers. Question 283. While palpating a female client's right upper quadrant, or uke, the nurse would expect to find which of the following structures: A. Sigmoid colon. B. Appendix. C. Spleen. D. Liver. Question 283. Answer: D. Liver. Question 283. Explanation: the uke contains the liver, gallbladder, duodenum, head of the pancreas, hepatic flexure of the colon, portions of the ascending and transverse colon, and a portion of the right kidney. The sigmoid colon is located in the left lower quadrant, the appendix, in the right lower quadrant, and the spleen, in the left upper quadrant. Question 284. A male client has undergone a colon resection. While turning him, wound dehiscence with evisceration occurs. The nurse's first response is to: A. Call the physician. B. Place saline-soaked sterile dressings on the wound. C. Take a blood pressure and pulse. D. Pull the dehiscence closed. Question 284. Answer: B. Place saline-soaked sterile dressings on the wound. Question 284. Explanation: the nurse should first place saline-soaked sterile dressings on the open wound to prevent tissue drying and possible infection. Then the nurse should call the physician and take the client's vital signs. The dehiscence needs to be surgically closed, so the nurse should never try to close it. Question 285. The nurse is monitoring a female client receiving paregoric to treat diarrhea for drug interactions. Which drugs can produce additive constipation when given with an opium preparation? A. Antiarrhythmic drugs. B. Anticholinergic drugs. C. Anticoagulant drugs. D. Antihypertensive drugs. Question 285. Answer: B. Anticholinergic drugs. Question 285. Explanation: paregoric has an additive effect of constipation when used with anticholinergic drugs. Antiarrhythmics, anticoagulants, and antihypertensives aren't known to interact with paregoric. Question 286. A male client is recovering from an ileostomy that was performed to treat inflammatory bowel disease. During discharge teaching, the nurse should stress the importance of: A. Increasing fluid intake to prevent dehydration. B. Wearing an appliance pouch only at bedtime. C. Consuming a low-protein, high-fiber diet. D. Taking only enteric-coated medications. Question 286. Answer: increasing fluid intake to prevent dehydration. Question 286. Explanation: because stool forms in the large intestine, an ileostomy typically drains liquid waste. To avoid fluid loss through ileostomy drainage, The nurse should instruct the client to increase fluid intake. The nurse should teach the client to wear a collection appliance at all times because ileostomy drainage is incontinent, to avoid high-fiber foods because they may irritate the intestines, and to avoid enteric-coated medications because the body can't absorb them after an ileostomy. Question 287. The nurse is caring for a female client with active upper GI bleeding. What is the appropriate diet for this client during the first 24 hours after admission? A. Regular diet. B. Skim milk. C. Nothing by mouth. D. Clear liquids. Question 287. Answer: C. Nothing by mouth. Question 287. Explanation: shock and bleeding must be controlled before oral intake, so the client should receive nothing by mouth. A regular diet is incorrect. When the bleeding is controlled, the diet is gradually increased, starting with ice chips and then clear liquids. Skim milk shouldn't be given because it increases gastric acid production, which could prolong bleeding. A liquid diet is the first diet offered after bleeding and shock are controlled. Question 288. A male client has just been diagnosed with hepatitis A. On assessment, the nurse expects to note: A. Severe abdominal pain radiating to the shoulder. B. Anorexia, nausea, and vomiting. C. Eructation and constipation. D. Abdominal ascites. Question 288. Answer: B. Anorexia, nausea, and vomiting. Question 288. Explanation: hallmark signs and symptoms of hepatitis A include anorexia, nausea, vomiting, fatigue, and weakness. Abdominal pain may occur but doesn't radiate to the shoulder. Eructation and constipation are common in gallbladder disease, not hepatitis A. Abdominal ascites is a sign of advanced hepatic disease, not an early sign of hepatitis A. Question 289. A female client with viral hepatitis A is being treated in an acute care facility. Because the client requires enteric precautions, the nurse should: A. Place the client in a private room. B. Wear a mask when handling the client's bedpan. C. Wash the hands after touching the client. D. Wear a gown when providing personal care for the client. Question 289. Answer: C. Wash the hands after touching the client. Question 289. Explanation: to maintain enteric precautions, the nurse must wash the hands after touching the client or potentially contaminated articles and before caring for another client. A private room is warranted only if the client has poor hygiene, for instance, if the client is unlikely to wash the hands after touching infective material or is likely to share contaminated articles with other clients. For enteric precautions, the nurse need not wear a mask and must wear a gown only if soiling from fecal matter is likely. Question 290. Which of the following factors can cause hepatitis A? A. Contact with infected blood. B. Blood transfusions with infected blood. C. Eating contaminated shellfish. D. Sexual contact with an infected person. Question 290. Answer: C. Eating contaminated shellfish. Question 290. Explanation: hepatitis A can be caused by consuming contaminated water, milk, or food, especially shellfish from contaminated water. Hepatitis B is caused by blood and sexual contact with an infected person. Hepatitis C is usually caused by contact with infected blood, including receiving blood transfusions.